My name is Amber Jones. I am 23 and I have hereditary angioedema. Hereditary angioedema is a genetic mutation, I believe, of the cells that stop your body from swelling. For me, a swelling attack is caused by sudden strenuous exercise, sudden changes in the weather, stress, and sometimes whenever my body feels like it.
So when did this start for you?
My first attack was when I was 10 years old.
What was that like?
Terrifying. My GP thought originally that I had appendicitis because it can present similar to appendicitis and gastro, which isn't fun, but each one has a different feel. Over the years, I have worked out how it feels when my stomach swells compared to when I have gastro. When my stomach swells, it's a tight feeling of pressure, and gastro just, well, everybody knows what gastro is like. It's really bad. Any part of my body can swell, inside or out. I've had my boobs swell on one occasion. That really wasn't fun. My throat swells, my chest, my hands and feet, my arms. I had my inner ear swell recently, actually, and I didn't know that could happen. And the only reason I worked out it was an attack was because my stomach started swelling as well. I had some medication, and as well as my stomach going down, my ear got better. So I'm still learning what parts of my body can swell.
How often do these attacks occur?
To start off with, it wasn't very often. I'd probably have an attack every 3 or 4 months maybe. And again, it's not any one particular place, it's completely at random. Other people have majority of stomach attacks or throat swells. For me, it is completely random. If I was to tally up everywhere that's had swollen, it would probably be pretty much even right now. But over the years, my attacks have become more frequent, more painful as well, some of them. Just recently, well, a couple of months ago, I had my back swell for 4 days, and that was really not fun. But when my specialist in Brisbane, an immunologist, he prescribed me medication. I was on tranexamic acid for a while to try and stop the attacks. Over the years, it stopped working, so I was prescribed Danazol, and that still didn't work. In recent years, we've had an injection called Firazyr, or Icatibant is the other name for it.
Yeah.
And that's a subcutaneous injection at the onset of an attack. The quicker I have the injection, once I realise that I'm having an attack, the quicker it works.
Yeah.
However, there are some cases where, for me, my throat swells when I sleep most of the time. So it's a bit of a delayed reaction because I can't get to it as quickly as I'd like, which means the Firazyr doesn't actually work the way that it should. In those cases, I have an injection as soon as I can. I give it a couple of hours, and if it hasn't worked, my immunologist has told me that I have to come to the hospital.
How does having this condition affected your life, socially as well as work-wise?
I've tried not to let it affect me, especially in recent years.
Yeah.
I used to hide my condition. I felt like a freak, basically.
Yeah.
And, you know, having to sit out from certain sports because, for example, volleyball triggered an attack from my arm. So during sports, I had to sit out when we played volleyball, and it resulted in me being picked on.
Yeah.
That wasn't fun.
No.
But it's just, yeah, in recent years, I've been more open about my condition, hoping to make more people aware, because currently in Australia there's about, I think it's about 130 confirmed cases of hereditary angioedema in Australia.
Mm-hmm.
The number is actually believed to be closer to 500, but that is cases that doctors don't know what they're looking for. They don't know what to look for because they've never seen it.
Yeah.
And the funny thing is, it's a simple blood test to determine if you have it or not.
Yeah.
But because of its rarity, it's not a common thought. There is a mutation of it that is not hereditary. You know, Joe down the street could suddenly have swelling attacks and no family history of it, but he's got what's known as type 3 of the hereditary angioedema, which is even rarer than mine.
Yeah. And what age is the onset for this disease?
There's no
Condition.
set age. It's different for everybody. There is a couple of cases I know of in the States where I believe it was a 6-month-old unfortunately passed away because one of the parents had the condition but never had an attack, so they never knew about it, passed it on to their child, and unfortunately the child had an attack that they couldn't work out what it was.
And your daughter, she's been tested?
Yeah, I had her tested when she was 2 because I knew there was a 50-50 chance of her having it being passed on from me. I spent about a week crying because she has it.
Yeah.
But it was basically knowing that she had it was my motivation for speaking out more about it, making my friends aware, making anybody who listen aware. Because the more people who are aware, the better understanding people will be when she gets older.
Yeah. So having said all that, let's go back to your experiences here when you've presented to Mount Isa Hospital. So can you go back for the beginning and just go through there? When was your first presentation here?
Not long after I moved up here. I moved up here September 2009, and I was only having an attack every couple of months or so. And it was at that time it was mostly stomach attacks, but they'd get so bad pain-wise, and I'd be so dehydrated from vomiting that I would end up having to come up here. And unfortunately, then we didn't have access to C1 concentrate, so doctors here were trying to give me fresh frozen plasma, and one of them even suggested, I can't remember what it's called. Adrenaline.
Oh, yeah.
And trying to treat it as anaphylaxis, despite me saying it's not anaphylaxis, it's this. There was letters from my specialist that had been sent up prior to me coming up here, to make them aware, basically, that
So they were on your medical file.
Yeah. But 9 out of 10 visits to Mount Isa Hospital have resulted in me leaving upset, feeling like I've been ignored. I'm terrified when I come here because even though I know that I'm having an attack because of how it feels. I've had doctors and nurses say, well, we think it's this, we're going to do a test for this and this. And they try and rule out, they do everything they can to test for anything but the condition. When I had a chest swell on one occasion and they were running tests on my heart, even though it was nothing to do with my heart. It was, the attack was down in here, and they're running tests up here. And I asked them why they were running tests on my heart, and they said, well, you're having chest pain. I said, it's an angioedema swelling attack. You will find there is a buildup of fluid which is causing it, and this is the medication I need to be given if you just look at the letters from my specialist. I left that day without the medication, as I have done on most occasions.
And how does that make you feel?
Terrified. I'm terrified that one day I'm going to leave here without the medication, and, for example, if it's for a throat attack, I'm terrified I'm going to go home, and if I go to sleep that night, I'm not going to wake up. It's terrifying. It truly is, because, like, as I said, for me, a throat attack comes up when I sleep most of the time. So it gets bad enough that I can't breathe when I'm lying down trying to sleep. So by the time I come here, it's pretty bad. The problem that I'm having, though, it's not a miscommunication. It's the doctors physically cannot see the swelling, and so they have said that it's in my head, pretty much. There is a stack of letters from my specialist explaining the condition and how it presents. And yet I've had doctors and nurses stand outside my room in emergency saying it's in my head.
How does that make you feel?
Crazy. And frustrated and angry, because I know that it's not in my head. I know that it's not a common disease or anything like that. So I know that it's a new thing for them. And I do understand that, but I feel like they need to try to understand me instead of assuming that because they can't see it, it's not in my head.
So what strategies have you used in the past when you hear those things and get that sort of reception to try and convince them that what you're going through is legitimate and that you're really in fear of your life? Being that you're not at your best.
Unfortunately, I haven't been able to come across any strategy that gets them to listen. I tend to, when I get told that it's not my condition, that it's got to be something else, I get really upset, and there has been a couple of times where it's reached the point where I've raised my voice. As bad as I feel about raising my voice, I feel sometimes it's the only way I can be heard. With an attack, I feel mentally and physically drained. I'm in pain. If it's my stomach, I'm vomiting, and sometimes there's even diarrhea, and it's really not fun. I am exhausted, and I'm scared because I don't know how long the attack will last. It could be a couple of hours, or it could be days or weeks.
And what does it mean to you that if you could be in an environment where you felt like that you're listened to and you get the right treatment?
To be in an environment where I'm going to be listened to and get the treatment that I need, it will make me feel respected and like I'm heard. Whereas at the moment, I don't feel like I'm respected or heard at all. I feel like a number, basically.
Mm.
I have, on a couple of occasions, been told that the price of the medication was very expensive, and that made me feel that the budget was more important than my health. I was, I felt rejected, and that my health just was nothing, basically. And to be honest, I shouldn't be made to feel this way. I see people come in and out, and they get the help they need, that they deserve, and the respect that they deserve. And then there's me sitting in a bed hours on end, waiting. I had a throat attack at the end of November, and a friend of mine who has not seen my throat swell before had actually spotted that my throat was swelling, and she brought me up here. I sat in ED for about 2 hours. I'd had an injection at home, and after sitting in ED for 2 hours, it had been about 6 hours since the injection, and my throat had gotten slightly worse, but it was still, it was bearable at that point. My doctor decided that he wanted to wait another 4 to 6 hours to see if I might need the C1 concentrate, to which I will admit I got very upset and cranky, and I told him that if he wanted to make me wait another 4 to 6 hours to maybe get a medication I should have received when I first arrived, that he could stick his waiting where the sun didn't shine, and I would go home and have more medication at home.
Mm.
I made a phone call to the head of the HAE Australasia organisation and told her what had happened, and that once again I was leaving without the medication. She used a few choice words, that this had happened once again, and made a few phone calls on my behalf, including one to my immunologist. About an hour after I left, I received a phone call from ED saying, "Come back in. As soon as you come in, we will give you the C1." I arrived about 15 minutes later, and I still had to wait 6 hours to receive the medication. And the medication is supposed to be pushed through manually to ensure that the whole dose of the drug is given without mixing it with saline or anything like that. The nurse decided that because they were busy, she was going to put it through a machine, because she didn't have the 15 minutes to stand with me to push it through. She ended up standing with me for that 15 minutes anyway, because the machine wasn't pushing it through the way it should have. And it just, it seemed very ridiculous. And I don't know what else to do. I do my best to not get upset with them when I'm there. However, every time I go to ED, it's like you're watching the same movie for the millionth time. It's the same story, it's the same words every time. Are you sure it's this? Are you absolutely 100% sure that it's your condition? And are you, I have been asked the same question 100 different ways. And it kind of makes me feel stupid, honestly, to be continuously asked the same things just in different ways. It makes me feel like they think that I'm stupid, that I don't know what I'm talking about. And the problem with that is I've been having attacks for about 14 years now. I know that as I said before, there are some, I'm still learning what parts of my body can swell and things like that, but most of my attacks happen in places that I've already had an attack. I know what it feels like. I know the difference between a stomach attack and gastro. I know when a different part of my stomach is swelling because it has that feel, but it's in a different area. I know when my throat is swelling. However, when my throat swells, my oxygen levels and blood pressure and temperature and everything like that, they're fine, they're normal range. But that's what happens for me. And it feels very redundant having to try and explain things every single time. I feel like that I get, every now and then I get the same doctor I've had previously, and I'm explaining about the condition all over again like he's never heard of it. And it's a never-ending cycle of being terrified and scared and angry and, you know, wondering if maybe this is the day they'll listen. And I hate feeling like that. I honestly, it's the worst feeling in the world.
Is there anything else you'd like to add or say before we wrap up?
No, not really.
Thank you so much. I know it's tough for you to share your story, especially today you're not feeling the best either, you've got a cold. And it's pretty emotional.
Yeah.
It's a lot of years of frustration you've got there, and then the added anxiety of your daughter as well. So thank you for your time and your bravery.
That's right, thank you.
Thank you. Go.
So now I'm having regular infusions. I have an infusion of the C1 concentrate once a fortnight at the moment to try and stop my attacks, because my specialist and I reached a point where my tablets weren't working at all. So he took me off them for about 6 months to see what would happen, and my attacks got even worse. I was having an attack pretty much every couple of days, and a couple of weeks before Christmas he started off organising fortnightly infusions of the C1, which I feel are slowly starting to work. I had a mild stomach attack on Friday morning, and the last attack I had before that was 3.5 weeks, and it's the longest I've been without an attack in such a long time. I can't even remember when. And knowing that it's starting to work makes me feel like I can live more of a normal life and be able to do a lot more things than I can now, which is a definite sigh of relief. It's going to make things a lot easier for me. I'm hoping that now that with the infusions working and having access to them, I'm going to be able to lose weight, actually do some exercise and lose weight and keep it off, because that's one thing I haven't been able to do at all, because exercise causes a swelling attack. If I go for a walk and I walk too far, the next day my legs from my hips down to my toes are swelling, which is really not fun trying to crawl around because the pain of standing is too intense. So I'm hoping that it's the start of a better life.
And less emergency presentations, we can hope.
Definitely, hopefully less emergency presentations.
Thank you again.